Thank you for staying with us. Today marks World Retina Day, aimed at creating awareness and seeking a cure for retinitis pigmentosa and allied diseases. Almost 100 million people around the world are suffering from retina diseases, a leading cause of blindness. To help us understand this disease, I'm now joined by Dr. Farah Moti, who is the president of the Ophthalmological Society of South Africa. Appreciate your time this afternoon, Doc. Now, what initiatives or activities is OSA involved in for World Retina Day to raise awareness about retinitis pigmentosa and those related conditions?
Hi, Hugo. Thanks for having us. So, retinitis pigmentosa is one of the rare diseases that Retina SA has been raising awareness about. They're an NGO that actually deals with all the rare diseases of the eye, mainly the retinal diseases. We're very far from curing any of these things. There's a lot of research going on in the UK about it. It's genetic studies, it's genetic therapy, which is incredibly expensive. At the moment, it is really looking for those patients, registering them, providing support for them in the ways of what they're able to do with their limits in vision, giving them support networks. Because to bring people together to know that they're not alone. It's difficult, it's debilitating when you have a disease that really there isn't a cure for as yet, and creating awareness so that there's enough funding to do the research and to also bring down the cost of gene therapies when they are more readily available. Now, what OSA has been focusing on more this year actually has been diabetes. Diabetic retinopathy is not a rare disease, but it's also a debilitating eye disease. And creating awareness around diabetes, we feel, is the biggest need, especially in South Africa, especially with the statistics that we have at the moment of the amount of diabetics that are currently predicted to be undiagnosed and how many more are going to have diabetes within the next 10 years.
So considering the rising number of diabetes cases in South Africa, what steps are you taking to address diabetic retinopathy, especially in terms of early detection and treatment?
Right. So the only thing we really can do to address the early detection is to encourage patients to go for screening. The first step of screening is not to go and screen your eyes, because about 50% of those patients we predict don't even know that they have type 2 diabetes yet, and that's the more damaging one. The reason it's more damaging is because those patients tend to only present once they realize something's wrong, and that means they've had diabetes for a fair amount of years and now it's gone and done the damage. So the first steps would be to go to a primary healthcare clinic or to a GP to do screening annually to check for diabetes. If we pick it up earlier and you start getting the adequate treatment, you're less likely to develop the retinopathy or the nephropathy, which is the kidney diseases, or severe cardiac diseases associated with it.
Now, you speak of cardiac diseases. You also speak of other diseases around the conversation is around diabetes and the eye. And so, is there a link between retinopathy or the eyes and these diseases, or is it just a case of if you have diabetes, then there is a possibility that some of these other ailments could strike you as well?
So diabetes is a disease of your entire body. It's not just somewhere in one little place. So in simple terms, diabetes is a disease that affects how your body breaks down sugar to use it for energy. And there's a problem with utilizing it well. And if you don't break down the sugar effectively to be able to use it for energy and have insulin uptake in your body, you have damage to your blood vessels and your nerves. The tiny blood vessels that it generally targets are within your kidney and within your eyes. And then you get the blood vessels that make up your entire cardiac system and your heart. And then the other thing that diabetes affects are your nerves. And so with the nerve being affected, it affects your toes and your fingers, firstly, called peripheral neuropathy. But your eyes, your retina, is actually made up of layers of tiny blood vessels and a nerve layer. So it affects the eye in two different ways in terms of its pathology. So it's not that it first does the eyes and then it does the kidneys and then it does something else. It's damaging all the tiny blood vessels in your body all at the same time.
So long and short of it is you don't want to get diabetes.
Long and short of it is type 2 diabetes has such a high genetic preponderance, which is why if you have a family member who has it, you probably will get it. So don't be put off and not test because you don't want to know you have diabetes. Rather find out earlier so that you're on adequate treatment, so that these diseases don't progress in your body.
Is it preventable, type 2 diabetes? If one family member has it, you suggest that you're likely to get it. How do you break that chain if you can?
By being more healthy, by exercising and by diet. There's a term called pre-diabetic where you're sort of borderline. You could develop diabetes, and if you go for screening yearly, you could be picked up as doing that. And then you change your diet and exercise and become a little bit more healthy in your lifestyle, and you could prevent yourself from actually developing diabetes.
So can you share some insights into the treatment options available for diabetic retinopathy and obviously how effective they are?
Right, so there's certain different grades of diabetic retinopathy, obviously starting early with the early detections, the small areas of blood vessel damage. And then you watch the patient and you advise them in collaboration with the primary doctor treating their diabetes to just have a bit tighter, more stringent control. And that's the first step. Before, we don't actually want to see patients where we need to do interventions like laser and injecting products into the eye, because that means there's such severe damage. So first step would be to be able to pick up these small areas of damage and then be able to advise the patient, change your diet, exercise a bit more, and perhaps increase the oral medication that you're on for diabetes to have a better glucose control. So your blood sugar should be lower. If that doesn't happen and they're still progressing, well, then you get pre-proliferative diabetic retinopathy, and if it is severe, then you start doing laser on the retina, and you can give some injections. They're called anti-VEGF injections into the eye. It sounds a little bit more scary than it really is, but I imagine anybody listening doesn't really want an injection into their eye. So that's the primary message we're trying to get across here. Prevention is always better than cure. If you screen early, you can prevent these complications from happening.
So I must ask the question, how can individuals access retinopathy screenings in South Africa? And what is the significance of these screenings beyond eye health?
So what's very exciting and what is new and has started obviously in the world of AI that we're living in is the digital screenings. You can take a fundus photograph of the eye at the back of the eye. There's lots of optometrists are able to do it. Ophthalmologists are able to provide the screening. We are working, there are certain district hospitals in the public sector that have these fundus cameras that can take these photos, and we're hoping to collaborate with the Department of Health to actually, roll this out better, where you can take a photo of the retina of the eye, and then you can detect from that what grade they are at, and so what action plan needs to be taken thereafter. In the world of AI, what has been happening and what has been shown is that depending on what the retina looks like, you can predict if the patient is at high risk of diabetic kidney disease or the level of cardiac disease that they're going to be at. So AI is quite exciting. It's up and coming. It's going to really transform in the next, I would say, 3 to 5 years in terms of what the eyes are going to be able to pick up of not just diseases of the eye and their progression, but what's going on in the rest of the body. It has already been shown, but those are small pilot centers. What I would hope for South Africa, to be practical, to be affordable, is that we reach the point, hopefully, where you could use something as simple as a cell phone to take an effective, high-quality picture of your retina. Because of the limitation at the moment is equipment and the cost of equipment and having equipment available at different centers. There are ways to take a photo of your retina with the phone of your camera, but they're not great quality yet. So they're not as easy to assess and give you accurate results. I think we can get there. I think if we encourage it and we talk about it, we would be able to do that. And that's a very, very affordable way of being able to provide screening in South Africa.
So look, let's look at the simple stuff, and that's general eye care, and how people determine whether or not they have 20/20 vision. Now, in most instances, you don't know that you can't see well until either somebody suggests it or whatever. I mean, as a...
Your driver's license test.
Yeah. So for me, it was as a 24-year-old. I was driving down the street one evening, and I asked a friend who wore spectacles if I could try on his spectacles. I tried them on and realized, geez, I was blind. I couldn't see. I mean, it was beautiful what I was able to crystallize at that very moment, but it was only because I tried on somebody else's spectacles. So I pretty much could have gotten spectacles a lot earlier. So my question is, what are the options? What tests can you take offhand just to gauge if you have 20/20 vision or if you're in need of some assistance in terms of spectacles?
Sure. So now, I mean, again, with the digital age, there are a lot of apps, not even an app that you need to pull up on your phone. You could just pull up a sort of eye test on your phone, and it'll show up a chart, and it'll tell you what distance to hold the cell phone from you. One of the things that a lot of people don't pick up is if you're seeing well, are you seeing well with both eyes? And that's the commonest thing that we see, where if nobody tends to cover one eye and then cover the other eye generally in what they're doing ever. So perhaps most of your vision is actually just happening through one eye, because we don't really cover and test one eye versus the other eye. If you're going to do these tests for yourself, make sure that you cover one eye and do a single eye at a time, and you can pick it up. What is happening and what should be happening is the eye screening at the school health level in primary school. And that does pick up quite a lot of children that have refractive errors. It doesn't happen again, though, in high school, which is when there's a new cohort of people that do need it. And I think the presumption has always been the reliance of you're old enough to have figured out you can't really see the board anymore. And I think that's actually, you bring up a good point. That's something we need to rethink, because there's not really a traditional school board a lot anymore. Certainly at a high school level, you're sitting with your books, you're sitting with tablets. Everything is becoming so much more digital that we need to create new ways to be able to assess at that level who can see what.
Dr. Farah Moti, happy Heritage Day, and thank you so much for speaking to us. He's the president of the Ophthalmological Society of South Africa.